Differences between schizophrenia and schizoaffective disorder. Being diagnosed with a mental disorder can be a relief. At last, you know what's going on. But it can also be confusing, even frightening. With mental disorders, it's not always clear what a diagnosis means when you hear it for the first time. And this is especially true for schizoaffective disorder and schizophrenia. Similar in some ways and different in others. Schizophrenia and schizoaffective disorders are two separate conditions. For a professional like myself, the differences are pretty stark. But if you're a layperson who was either diagnosed with these disorders or concerned for a loved one, it can be pretty difficult to parse what a book like the Diagnostic and Statistical Manual of Mental Disorders, or DSM, is saying. So let's explore this fraught subject and gain some clarity. Schizoaffective disorder and schizophrenia, the big differences. Okay, here's the big difference between these two mental disorders. Schizophrenia is a mental disorder with symptoms including disorganized thoughts, hallucinations, and/or delusions. Schizoaffective disorder includes the symptoms of schizophrenia along episodes of anxiety, depression, or both. So these are both serious disorders to be diagnosed with. And I'm sorry to say that, like most other mental disorders, they're not really curable. However, what they are is manageable. And I've seen many people with these conditions get the help they need and live full and happy lives. What is schizophrenia? Schizophrenia is a mental disorder that involves psychosis, which means it affects how a person perceives the world around them and how they participate in it. According to the Mayo Clinic, there are a range of issues that can indicate schizophrenia. Delusions are false beliefs with no basis in reality. Another symptom are hallucinations, seeing and hearing things that aren't real. Audible hallucinations are very common in schizophrenia. What is schizoaffective disorder? Schizoaffective disorder combines the symptoms of schizophrenia with episodes of depression and mania. There are two types of schizoaffective disorder. The bipolar type includes episodes of mania and sometimes major depression. The depressive type only includes episodes of major depression. Also, like other mental disorders, schizoaffective disorder may be unique for each individual. Unfortunately, we're still unclear on what actually causes these conditions. There may be a genetic link. If you have a close relative with these conditions, you may be at more of a risk for developing them. Are schizophrenia and schizoaffective disorder treatable? Yes, they are not curable in the traditional sense of the word, but with medication and counseling, their symptoms can be managed for a lifetime. Let me stress this: schizophrenia and schizoaffective disorders are both extremely serious conditions. However, it's possible to live a long and happy and productive life while managing their symptoms. If you or a loved one are struggling with these conditions, the time to act is now. Schizoaffective disorder and schizophrenia get worse if left untreated. Reach out to the Edge Treatment Center today at 844-590-0403, and we'll get started on developing the right care plan for you or your loved one.